Hey guys, this is Dr. Hub. Today we are looking at the male infertility causes. So we are dividing it into various categories. Now first we look at the pre-testicular. So what are the pre-testicular causes? So it can be due to the endocrine issues. So due to endocrine. So what do you mean by the endocrine issues? So endocrine issues, it can be due to the gonadotropin deficiency, the gonadotropin. So in terms of the gonadotropin deficiency, next is in terms of the thyroid dysfunction, or in terms of the hyperprolactinemia, hyperprolactinemia. Next, in pretesticular, it can be due to the psychosocial. There is psychosocial. So under psychosocial, it can be due to the impotence or the ED, that's erectile dysfunction. Then we look at the drugs. So under drugs, there is the antihypertensive, or we can write it as ATHF, antihypertensives, or in terms of the psychotics. In terms of the antipsychotics. Now we look at the genetics. So it can be due to the genetics, that is the 47XXY, or in terms of the Y chromosome deletions. Next is there can be due to the testicular causes. So let's look at what are the testicular causes. So under the testicular causes, it can be due to the immotile. It may be due to the immotile cilia syndrome, or it can be due to the cryptorchidism. Next is the orchitis. It may be due to the orchitis, that is presence of mumps. There can be TB, there can be gonorrhea, as well as the traumatic. Next is the presence of the toxins. The toxins, it includes the drugs and the radiation. Then comes the primary testicular failure. And next is the Sertoli cell only syndrome. There is the Sertoli cell only syndrome. Then comes the oligo. There is oligoastheno teratozoospermia. Then we look at the post-testicular causes. The post-testicular causes, it includes the obstruction of the efferent duct, and obstruction of the efferent duct, it includes the congenital. There is congenital means there is absence. There may be absence of the vas deferens, so there may be absence of the VD. VD is the vas deferens or the Young syndrome. Next is the presence of the acquired or the inflammatory block. So what does this include? It includes the TB, that is the tuberculosis, or the gonorrhea. Next is the surgical. Under surgical, it may be due to the vasectomy and others. So what do others include? It can be due to the ejaculatory failure, it can be due to the bladder surgery, or the retrograde ejaculation. you.